Oh, great to be here. I'm sure I'll be covering some things that you've heard before, but I'm really glad to be here to give you a little bit of a view of what it's like for nurses in the future when it comes to technology. So again, my name's Jason Westwood. I'm the program manager for the National General Practice Nursing 10-point plan, a 5-year program and in its final year right now, just about to enter its final year. 10 actions really designed to develop practice nurses into the future, adding in workforce elements, and one of the areas that we're working on is, of course, technology. So people have got very, very different perceptions of nursing. They see nurses in the future looking a bit like this, various different things strapped on here, there, and everywhere, very unrealistic. They also see this. Who would really want AIs and robots with syringes that large really coming towards patients? No, we don't want that. And I draw the line at having a really single-use disposable hug. That's really where the line is drawn. I think it's time to really be a little bit realistic. And we know very much that healthcare will remain a very personal experience despite the digital world. Interesting question was asked earlier on, which was about shifting the workload. Nothing we do really must add extra to the workforce or add a basic burden to patients or the workforce that's dealing with them. The skills we offer our changing workforce, and I stress a changing workforce, because the nurses we have now and have been part of our program are adding skills every day, adding more advanced skills to take on some of the more complex elements of primary care. But their technology that we put in to enable their work should be there to really physically enable them and not disable. It's about really, as well, making the patients understand a little bit more about their own self-care and about ways to look after themselves as well along the way. The ultimate aim with any technology implementation is to provide a better outcome and an experience that's better than before for patients without any loss of that personal contact we all seek. And I'm sure we've had some experiences of our own that we want to continue despite technology being there to help. So these are the bits that I'm sure colleagues have covered off, and we've had a lot of talk about the long-term plan. For us at NHS England, it's very much this part now, really, moving on about that long-term plan. And I'll just pull out some of the elements of the 5 areas that you've had other colleagues talk about earlier on. But some of the key ones that we really wanted to really move forward with, again, is these supportive apps. Again, colleagues from Redmore Health and colleagues that we've been working with and a team in Stoke have moved forward and helped with us to provide a batch of very helpful apps for nurses to work again with patients in that long-term care provision. Again, supporting healthcare professionals. Our patients will not get better outcomes if, again, the professionals themselves are not supported. So our digital leadership, which I'll come to in a second, has been a prime area of the GPN 10-point plan. The supporting clinical care, very much looking at, and I was really enthusiastic to hear that our colleagues are being very realistic about online consultation, because that's exactly the triage element is where we are right now, but the future comes forward with video conferencing and other elements, and again, I'll speak a bit more about that later on. Improving that population health, Martin's here today to tell you a little bit more about using some of those analytics, and using the power of the data that you're collecting is highly, highly important. Improving the clinical efficiency and safety, again, we've had lots of talk about IG and really moving forward with some of those and being safe in a very changing environment, especially when you're introducing some new digital initiatives. But again, it's really, really important to have those in mind. I saved a good one for last, really, is that open source is still considered to be a very effective and emerging area of applications. where I was really glad to hear that some of the apps we've mentioned today are not for profit and have been developed within the NHS through innovations, but then move on and be developed through an open source principle. So it's often not looked at, but then again, it's a very thriving area, so one for us all to have a look at. So moving on to our general practice nursing perspective and what we wanted to really do. And we kept it simple because that's exactly what the nurses said that they wanted it to be. We've concentrated on 3 objectives, and it's about producing digital ambassadors. Everybody's skill levels is very, very different for nurses across the patch, from very basic levels all the way to those experts who really want to move forward and be innovators in general practice nursing. So supporting that, we've started to pull together digital ambassadors. Again, I'll talk about these again later. We've also wanted to facilitate supervision through a digital platform. We know that it's very difficult in a busy environment, primary care environment, for supervision to be anywhere within people's thoughts. So producing something that's easy to use and really there to help and support the workforce is something that we really wanted to do. Plus, lots of talk today about a single sign-in. We've all got too many logins, and the one thing we wanted to do was provide a place for general practice nurses to get exactly assured information, and we've moved forward with a single point for that, and I'll talk about that again later on. So the first one really is around, is about the idea of having digital ambassadors. We really wanted out there to have people who were gaining skills to join a primary care team and be part of that team and take that team onto the next level in terms of innovation. So we worked with a team at Stoke and moved forward with a number of what was called action learning sets that covered off the real basics right through to more advanced use of technology. So last year we trained 200 people to be ambassadors. We're 80 again this year and 80 again next year. And those ambassadors actually will be within the primary care environments, moving forward and taking the skills that they've learned through those action learning sets forward for the future. It covers all sorts of areas, and those action learning sets cover use of both technology, the data and where that actually comes from is an important factor, and then also using social media again for engaging with patients and looking after some of their long-term conditions. So the next area we wanted to have a look at was the digital supervision. So the background to this is that clinical supervision varies across England. One end of the scale, nothing is happening, and others have got a quite embedded supervision programme. Some CCGs support it and their STPs in one way or another, whether that be a practice educator that's got some skills in supervision, others don't. So there's no consistent model out there at the moment and used across England, and revalidation has become even more important for general practice nurses, and so therefore we wanted something to really help around this area. So our digital supervision ask was this. It was about simply producing an easy-to-use portal that was available on multiple platforms, whether it be the desktop machines within the practices or on smartphones, laptops, and tablets, etc. It needed to support both group and one-to-one supervision. We're finding now that group supervision is used extensively now because of that working environment, and also where PCNs, the primary care networks, are developing, and also where super GP surgeries are coming together, and their nurses are more disparate in various different areas and needing to come together as a group rather than one-to-one. But it also, where needed to, support one-to-one. Flexible access across multiple platforms, I've said. The most important thing is making sure that it's scheduled in properly. All the nurses we dealt with during our pilot phases said that that's the most important thing, is to make sure that they're given the time to undertake even this innovative approach to supervision. So the platform needs to encompass that consistent model as well. So alongside what we've done is started to develop a work stream. So here we are on that work stream. So the platform needed to be really cost effective. So either cheap or to very as near as free as possible. So that's exactly what we're developing. It needs to be scalable and being able to change, because as we know, the environment as primary care networks are changing as we speak, and so therefore needs to take into account of those changes. It needs to have a level where there are supporting our model that's forming, which has the 3 sections of having support for supervisors, a consistent approach in their methods of supervision, and then also giving some assurance at the delivery of the various different nursing roles within primary care. So that we've tried to integrate into the supervision model itself. So I've done a basic job of trying to describe it. I'll let the animation speak a little bit more for me.
There is never enough time. Always things to read, people to see, and patients to care for. Some things are worth putting time aside for. Time to reflect on you and your practice. Time to get help and support from a skilled facilitator and colleagues. Time to focus on clinical practice, including team dynamics, communication and personal resilience. Time to take stock and plan personal development, and time to improve patient treatment and care. All we have described here is the definition of clinical supervision. We know that in a busy environment, freeing up time to spend on patients, and more importantly you, is difficult. Technology is one solution that can help. Last year, we began to develop a digital platform that will support supervision across health and social care. It's designed to be flexible and can be accessed on desktop and mobile devices. Using this technology on a smartphone or tablet offers you the opportunity to undertake supervision sessions where and when you want it, reducing the travel and parking problems of a face-to-face meeting. It supports supervision between individuals and groups over video conferencing. Having the chance to reflect on aspects of your day-to-day work is both important and offers opportunity to improve care together. Included on the platform is all you and your supervisors need to support high-quality supervision sessions. This consistency offers you and your colleagues the assurance that supervision is being approached equally across your health system. No one likes paperwork, and it's another drain on time. Our system enables recording of any key points and learning outcomes from the sessions, and forms a record you can use to evidence your supervision or use in revalidation. Privacy is important too, so don't worry, none of the audio and video is recorded. We believe that combining a consistent supervision model and a digital platform will improve quality assurance and offer greater flexibility. So make some space on your phone, switch on your Wi-Fi, and get those desktop cameras ready. Digital supervision is coming to help you and your patients. Find out more at...
Okay, so we've developed this in conjunction with NHS Digital, and you'll see the video lends towards that this actually can be used in other healthcare systems. The next step for it is actually to be used in social care, and NHS Digital will be moving forward with those plans next year. For us anyway, our phase 2 aim for the programme is to integrate this into our Futures NHS platform, which has formed to be a project and collaboration platform supported by NHS England. So again, reducing the amount of logins and keeping the information in one place. I'll talk about the single point, which is part of the NHS Futures platform in a second. Gain the capability to record group and one-to-one session headlines. As the animation mentioned there, it's really key that those can be recorded for the group that come together, and that can be run off as a revalidation report for nurses at the end of a year and include in their NMC revalidation. And embed the support and formation of the national model. So in spring this year, we hope to roll out this platform in conjunction conjunction with a consistent model of supervision for general practice nursing. So this is agreed with our colleagues at Health Education England, and that consistent model will be a core, and you could see it again in other areas of healthcare as well, as a core, and there'll be elements that have been specially adapted for general practice nurses and the more advanced roles that are coming along, such as advanced clinical practitioners. So finally, again, when we mentioned about pulling things together in a single place, and the single point that we've developed now is a home for all our assured programme resources. We keep it very much up to date with the news and discussions that are going on. We have a very active forum of nurses who are discussing their practice. There's a national project area, so you can see as our work's coming together, and events and opportunities. And as I said, our key aim now is to make sure that the clinical supervision platform that we're developing, we're working very closely with Public Health England in their All Our Health areas of work, and they will be fully integrated into the platform. So there's no need to be swapping around to different websites that we all get concerned about and logging into to other things. By all means, after today's session, anybody wanting to come in and have a look at the single point, you can email there. But news, which is bang up to date, as of Friday, 12 o'clock, please wait till after 12 o'clock, the actual GPN single point is going open. So we know that there are others out in the primary care environment that really want to see what we've been doing. So we're taking the network and platform to an open status, allowing everybody to come on board and have a look at what we're doing. So finally, just wanted to say about what's coming in the future. So for us within the programme, we want to then move on very quickly with supporting even more digital ambassadors, which we've mentioned there, 80 more next year. We want to take the learning that's been developed around the digital supervision platform, so people will gain the knowledge of using video conferencing to the next level in clinical practice, so using video consultations and integrating that in with the work that's been going on about online consultations. But more importantly, as I said, and pointing back to the initial elements, is actually adding something to the care, not adding a burden, etc., to the work that the nurses are doing. It's actually allowing them to increase the level of care that they are doing in a more structured and easier way. So again, thank you very much for inviting me today. There's my details if you want anything further, and then I'm sure the slides will be going out afterwards. Thank you.